All right, I'm going to start. You're welcome to come closer if you like. My name's Lauren Brown. I'm from Canada, so I'm friendly and safe, so you can come closer. I'm not from my neighbor that's near me in Canada, so I'm approachable. So I'm from Vancouver, Canada. I've been in practice since 2000. Before I did Chinese medicine, I was what's called I don't know if you have this, a professional accountant, a chartered accountant, CA, CPA. And because of health issues, I got into Chinese medicine and did the Doctor of Chinese Medicine, and later done other training. I do hypnosis. It's part of my practice with acupuncture. And my clinic is called AcuBalance Wellness Center, and we focus mainly on fertility. We see all kinds of things, but we're famous for fertility. I personally got acupuncture on site at all the IVF clinics in Vancouver. It used to be quite hostile. They told their patients not to come for acupuncture at all, and it was a challenging journey starting in 2002. I started in 2000. In 2002, I started to try and go on site, and by 2008, I persevered, and they built rooms for us. By 2010 or 2011, they built rooms for us to be on site. So integration can happen. So for those that are looking to integrate more with IVF centers, I'll let you know that it's quite common that they're a little suspicious of what we do and skeptical of what we do. However, through persistence and open communication, which I'm happy to chat about today as well, you can develop that relationship. And it's an important relationship because the couples you see, the women you see, will do whatever they can to get pregnant. And so they're not just going to see you if you're doing acupuncture and the general Western medicine workup. They'll pursue ART like IVF or ovulation drugs. So this is what we're going to talk about today. So my outline is to share with you why acupuncture can optimize fertility. We're going to talk a little bit about the mechanism. Then I'm going to share my protocols, so things that I've been doing in my clinic, kind of how I distilled it down in some of the basic acupuncture protocols, or my favorite acupuncture protocols for those conditions: PCOS, stress-induced infertility, blood flow, thin lining. We can talk about male infertility. It's really underserved, and so we'll talk a bit about what we can do for the men. We still haven't figured out how to get the men to come into the clinic. It's still a challenge when I talk to anybody, no matter, it seems to be culturally the same around the world. So I haven't found a country where men are running to get treatment to increase their fertility. So much so that it's quite interesting when you have a couple and it's male factor. Oftentimes, I'm sure you've had this, it's the female that's in your office, but it's male factor. So he doesn't even attend the initial workup. So we have a lot of education to do, and it's possible to reach the men. So I'll share a little bit about how I do that as well. I'll talk about acupuncture for IVF and unexplained infertility. Now, I did a laser workshop yesterday, so I'm not going to reteach that, but I'll highlight a bit of the laser for fertility, just some highlights. And then, time permitting, kind of when the lecture's done near the end of the day, our day together, if we have time, I'm happy to show the protocol, what I'm doing for laser for fertility. Now, in the treatment room, I always set the intention with my patients and for you guys. I want things to be powerful, effective, and simple. I'm not a super intelligent guy, so I really like to distill things down to the basics and simple. So that's how I get success. One of my teachers said, to be a master, you need to master the basics. Okay? And so today my intention, it's going to be powerful, effective, and simple. So I know we like a nice dish to look like this, but really what I'm going to go for is just the basic oatmeal. Okay? And it's still really good for you. It still tastes good, and it's going to get the job done. And so that's what I hope you're open to learning from me today. It doesn't need to be complicated. If you remember the Indiana Jones movie, remember the guy with the big sword? And then Indiana Jones just shoots him. So we could sit here and I could say we got to tap on the divergent channel and we got to do this and that. I'm going right to powerful, simple, effective. And that's kind of my claim to fame. I used to be, as I told you, an accountant. I still am not practicing. But I wrote a book for acupuncturists from the business side of your practice with a spiritual twist, how to be successful with integrity. And it's simple, short little chapters. Each chapter, when I wrote it, was meant to be simple, powerful, and effective. And that's what I'm going to give you guys today. Here's the risk when you bring this into your clinic and when I bring this to you. It's so simple, what I'm going to share with you, that it's at great risk of being dismissed. I don't know why, but we like things to seem so complicated, so challenging. And if it's not, it has no value. So what I want to share with you is that I'm going to share with you some simple, basic protocols. You know them all. But they're so simple that you're going to just at risk of dismissing them. So let's get started. What my intention is for this lecture as well, as I share my favorite fertility acupuncture protocols, is kind of to borrow from your ear. Had a course we streamed for him called What to Do When You Don't Know What to Do. So this is what to do when you don't know what to do for fertility. You know, some days a patient comes in and it's just so complicated. There's so much going on. And you know, you get that imposter syndrome. You start to feel really nervous, like how am I going to help this person? You feel like a fraud. There's just so much going on here. That's what this lecture is about. Oh, I know this stuff works. I can at least start with this. I don't have to figure it all out today, but I can start because you know, last thing you want to do as a practitioner, as a physician, is to treat somebody and you don't believe it's going to help them. So to know that here's stuff that can help your patients, there's some evidence-based protocols that can help your patients. It's just a great way to start when you don't know what to do. Or on Monday, because you're so tired from all the dancing, drinking, and lectures, and your brain's just not firing quick enough, this is when you can come back. If you're using the Master Tong or the YNSA scalp acupuncture and some other fancy stuff out there, you can go to that on Tuesday. But on Monday, you got this stuff that you can use, all right? Fair enough? So that's what we're going to share. I will let you know that in clinic, I'm a herbalist, so my patients, most of them are on herbal medicine. I do powder concentrates, so kind of like the KPC or Sunten, if you get those kind of powder herbs. Customized though. They're on nutrients, vitamins. They're getting acupuncture. Many, maybe half will get laser as well. I'm always doing diet and lifestyle. I'll do belief change modalities, so hypnosis, Psych K, EFT. So that's what I'm doing in my clinic. Just so you know, clinically, that's how I treat in my room. Today, I'm just sharing with you the acupuncture part of my practice. Now, when you know the why, the how becomes easier to do anyhow. And what I'm going to do today is share with you the language that I'm sharing with my patients, the metaphors that are really powerful. Because even if you are the best acupuncturist out there, if you can't inspire and motivate your patients to see you, to continue to see with you, you never get to implement your treatment plan. So I've met geniuses where patients come in once or twice and they never see them again because they weren't able to motivate and inspire your patients. Now, you may be passionate about Chinese medicine and acupuncture, but half the population has a fear of needles. So I know a lot of us have these beautiful pictures of acupuncture needles on our website and burning moxa off of it. We love that, but our patients, that scares them away from us. And so part of being a healer is to be able to treat your patients through a course of treatment. So even if you know what to do, if you can't inspire and motivate your patients, then you can't help your patients. And so often people come and say, you came here for the protocols, you came here for the points, right? And I'm telling you that, yeah, I'm going to give you the points, but I'm here today to give you the language to communicate with your patients so you can do the points. And if you like the things that go beep, beep, and that are really complicated, you can do that too. But I'm going to give you the language that will talk to your patients, motivate them, inspire them, so they'll let you treat them for a series of 3 to 6 months, if necessary, to get the results that they're looking for. Fair enough? Because that is what, I know you came here for the points, and I'm going to give you the points. But I'm also going to give you the other stuff that you don't think you need. But the profession, acupuncturists, physicians, or anybody who are doing acupuncture, are not seeing enough of their patients. Now, there's no shortage of patients. There's no shortage of infertile couples. There's no shortage of sick people, but they're not seeking you out enough. And that's because they don't have the education or the communication. They're not receiving that to know what we can do to help them. And telling them about the yin and the yang and the shui and the zhu is not going to bring them into your treatment room. So I'm going to give you language for your patient. So that's my approach today as well. And when the patients understand the why this will work, what we're going to share today, then the how becomes easier to do. And what is the how? Showing up once or twice a week for acupuncture, changing their diet, stress reduction, going to bed at 10 o'clock versus 2 in the morning, exercise or less exercise, sleep. That's part of the how. And so for your patients to do the how, they need to understand the why. So I'm going to give you the why that I use in my clinic to give them enough of the information education that it resonates with them so they're willing to allow me to treat them and allow me to treat them long enough the way I know the medicine can work to get the results they're looking for. So the first thing I want to share with you is the healthy baby approach, and this is what I share with my patients. So we're having a consult, and I share that our goal is healthy baby. I don't know anybody that's come into my clinic that wants to get pregnant. They say they want to get pregnant, but I've had people with recurrent pregnancy loss. I don't think they feel that they're having successes with that. So they don't want to get pregnant. They want to have a baby. And you know what? I've never met anybody that wants a sick baby. Now, people have children that aren't healthy, and they love their children, but nobody chooses to have an unhealthy child. And so their goal is healthy baby. And so I share with them, being an accountant, there's a mathematical equation for healthy baby, and it's quite simple. Healthy baby equals healthy egg plus healthy sperm plus healthy uterine environment. That's how we're going to do a healthy baby. So we focus on the egg because she's with me, and then we also talk about the other part of the equation, the man. So I said earlier, how do we get men into our clinic? All the men that come into my clinic, not all, majority of the men that come into my clinic, when I ask them why they're here, they say, my wife told me to come here. So all my blogs and all my information refers to him. Why? Because I know the guy is not reading my blog. I know it's the female that's reading the blog. So I talk about male fertility to the female, and then if she's enough of an alpha female, the guy shows up in my office. If she's not an alpha female, then she doesn't. He doesn't show up into my office. So that's been my observation. Basically and I'll share a fun little story with you, and we'll jump to male fertility later, but I want to talk about the sperm because Olivia talked about it earlier, team sperm, and I figured let's give it a little bit more attention because we all talk about it's important, but even in our talks, I got like 3 slides for the guys and all these other slides for the female. I remember she's 40, she comes to the clinic, and it's one of the rare patients that comes to the clinic, I'm 40 and I want to have a healthy baby, so I just want to do preconception care before I even try. She had a history of fibroids, they've been removed. She comes. I also want my husband to come in because I want this healthy baby. Great. So I've been treating her for a couple of weeks. Then one of the sessions, he comes in after. That was his scheduled appointment for his initial consult. So she's leaving. Sorry, he came in first. He's leaving, checking out with reception. She comes in, she sits down, and she says, did he book any follow-ups? Did he take the vitamins? Because I told her this is kind of what the guide plan is. And I said, no, apparently we recommended treatment, we recommended supplements, but he said no thanks, and he just left as you passed him. He goes, 1 second please, Lauren. She leaves the office, goes out into the hallway where the elevators are. You hear a kerfuffle. Is that potatoes? In English, that's like motion. And next thing I know, she comes back in and she says, yeah, he'll be booking those appointments and he's taking those supplements now. So she was the alpha female. So he took the vitamins and they've had 2 lovely kids. She never had fertility issues, but that's how it works. The other equation or couple I see is where he says, I don't believe in this, I'm not taking it. She's having recurrent pregnancy loss. She's doing 2 IVFs. It's male factor. She's crying on my table, and she's saying, no, he won't do it. So often in my mind, I like to give her like the relationship advice. I question why she's with this guy, but at the end of the day, if that's where the relationship is, the guy doesn't come. And I don't push it because that's a relationship thing, and that's how their dynamic is, and it's going to be difficult to get that guy into your treatment room. So I don't know what it's like in Germany, but in Canada we have a mixture of men that are wearing the pants, as they say, in the relationship, and we have it where it's equal, and we have it where females are wearing the pants. And if it's the female's alpha or it's an equal relationship, we get to treat the guy. If the guy's the dominant in the relationship, I don't see the guy most often. So back to our healthy baby equation. Healthy egg plus healthy sperm plus healthy uterine environment. So that's our key. And I share with them, I am not so concerned whether that happens in your bedroom or in a lab. I want a healthy baby. Sometimes, because I'm not anti-IVF, I just believe in medicine. And so sometimes IVF is a great option for that couple. It's in their best interest for that couple. Sometimes. And so I just want a healthy baby at the end of it. And if IVF is going to give it to them in the lab, then great. And if natural is going to give it to them, great. The beautiful part of the preconception care is whether they're doing IVF or trying to conceive naturally, healthy baby still requires healthy egg, healthy sperm, and healthy uterine environment. All that stuff happens before intercourse for conception, before an IVF. So you're still involved in that preconception care. So that's the healthy baby equation.